SEG training video, strabismus. Let's talk a little bit about strabismus. So that term in itself can be confusing. What strabismus means is the eyes are not pointing at the same place. And you can see this little baby's right eye is crossing in while her left eye is looking at you. That's a strabismus. So the eyes, strabismus just means the eyes are misaligned. When both eyes are open and looking, one is pointed at the direction of fixation, means one is looking at the target or at you, and the other is pointed in another direction. Again, in this picture, this adult's left eye is crossing in and their right eye is looking at you. Other names you may hear are tropia or eye turn, crossed eye or lazy eye are sometimes what our patients say. And what it can result in, if an eye is crossing for very long, the brain starts ignoring that eye, which we call suppression, and it's not being used. It actually doesn't have as many brain pathways to that eye. It results in blurry vision in that eye and really a developmental delay of all of how that eye needs to see, focus, and work with the other eye. There are different types of strabismus, and there's a nice picture here showing the variations. You can see the top picture shows normal, so if this patient is trying to look at you, both eyes are looking. The next picture down shows hypotropia, which is the right eye is aiming down. Kind of the opposite of that is the next picture down showing the right eye is aiming up, and that is hypertropia. The next picture down shows exotropia, and exo means out, so that right eye is wandering out. Some patients call that a lazy eye. And esotropia on the very bottom, the right eye is crossing in, or some patients call it a crossed eye. There are other terms you may hear in the exam room. Alternating means the patient looks with one eye, then the other. They can switch back and forth. Constant means the eye is misaligned all the time. And intermittent means it's only happening sometimes. And that can be really frequent to not very frequent. And we do see all of these in our clinic, and we can treat all of these. How does this happen? Why does this happen? So it really happens as a problem in infancy, and there are different risk factors for not developing our eyes to aim in the same place. Some of those are just any delay in normal development for a baby, if there's risk factors when babies are in the womb, or if there are problems after a baby is born. Each person learns how to process what they see differently, so sometimes there isn't any one thing we can look back and blame it on. It just is development. There also is genetics. If there's a strabismus in the family, we know there's more risk for other strabismus in the family members. And then there's problems with if one eye is not seeing very well, it can actually cross in or wander out. And that can be due to a problem with their eye health, or a problem with like a blindness, or any kind of problem in the back of the eye, or it can just be a problem that eye needs a prescription. There can also be problems with how the eye muscles develop. Some babies don't learn how to move their eyes out toward their ear, and we see that a lot and can treat that. And it can be a problem with how the eyes are coordinating together. We also see strabismus after injury or trauma. For example, a patient that was hit by a car and hit his head on the pavement developed an eye that went in and up. So what happens with strabismus, and how does it affect daily life? It definitely can cause poor vision in one eye, the eye that is turned, and that's also referred to as amblyopia. So they definitely can cause, they can kind of have both problems happening at once. Strabismus can also cause double vision. So if the brain's not ignoring that eye, the only option is to have double vision. So if your eyes don't aim the same place in space, you have double vision. If the brain ignores that eye, causing amblyopia, they don't have double vision. So there's only two options. Any kind of strabismus decreases depth perception or 3D, and some patients have a little bit, and some patients actually have no 3D. It can also prevent patients from having certain jobs. It can have a long-term impact. Pilots need to have strong 3D. They cannot have a strabismus. There are other jobs where strabismus would not be allowed. It can also prevent our patients from excelling in certain activities, anything requiring good 3Ds. You can imagine driving and sports, particularly ball sports, general activities of daily life, overall balance, coordination. Those things can be more limited for a patient, as well as reading using both eyes together. So it can impact education, it can impact job, and it can impact overall hobbies and enjoyment of life. We also see a lot of interpersonal, professional, and aesthetic concerns. So, for example, we have patients who are adults who have had a strabismus for their whole life or a long time, and one of their concerns is that they, when they meet with someone, particularly professionally or even just socially, people don't know where to look if there's one eye looking at them and one eye not, and that can be a problem. It can also impact professional advancement in jobs if there's a strabismus. So what can be done? This is another reason why we promote annual eye exams. We want to catch and treat strabismus as early as possible. We can actually catch this early and help prevent it from becoming more of a problem, which is very exciting. Prescription glasses may be needed with either some prescription to help the brain use that eye. Prism can also be used to move where the target is that the patient's looking at, to decrease the amount of the eye turning. We sometimes are using patching, but we are using that less often because there's other options. We use our vision therapy clinic to treat strabismus for any age. We see infants to adults, and we can train the brain to use the eyes, decrease the amount of the eye turn, and build 3D. We also will sometimes co-manage surgery, so eye muscle surgery. We are not surgeons, so we don't do the surgery, but we will refer for this surgery and then do vision therapy before, after, or sometimes just after the surgery to get the brain paying attention to the eye. Surgery moves the eye muscle. Vision therapy gets the brain using that eye in both eyes. What should patients and parents know? That we treat all ages with strabismus. We treat infants, kids, and adults. Our doctors have done extensive postdoctorate training on strabismus and are some of the best in the country. Yes, we continue to do continuing education and in this specialty area. We use the most current research. We are always looking at that to see how we can better help our patients. And patients and parents just really need to know there is hope, that there are treatment options in addition to surgery that can help the eyes align and stay that way. Some patients have only heard that surgery is an option. Some patients have heard that there are no options. So hope is something we can definitely share with them, and we can teach them to see 3D.